Hello everyone, today we are going to learn about Talon's cusp. What is Talon's cusp in detail? So the Talon's cusp is nothing but a projection that projects lingually from cingulum area of maxillary and mandibular teeth, or it is an anomalous hyperplasia of cingulum on a lingual surfaces of maxillary and mandibular incisors, which is going to result in formation of supernumerary cusp. So it is like a supernumerary cusp. Now let us see clinical picture of Talon's cusp. So as you can see in this picture, there is a lingual projection which is present on lingual surfaces of maxillary incisor, and it is nothing but an anomalous hyperplasia of cingulum. As you can see, it is arising from the cingulum area. Now let us see pathogenesis in detail. So it is nothing but a focal proliferation of tissue during development. So there is exuberant development of fourth lobe, that is cingulum, may occur. Because of that, Talon's cusp has arisen. Now next, moving forward to clinical features in detail. So first of all, it is common in both dentition, both in deciduous as well as in permanent dentition. So it is commonly seen in maxillary lateral incisor and central incisors. So this condition is usually occur on incisors. It resembles like a eagle's talon. That is because only it has name given Talon's cusp. So there is a deep developmental groove we can see where the cusp blends with slope of lingual tooth surface. So what are the composition of this Talon's cusp? So it is composed of normal enamel dentine and contain a form of pulp tissue as well. So it has the same anatomy as normal tooth, having enamel dentine and pulp. Patient can also face the problem with aesthetic, as it will not look good from lingual surface. It is also associated with Rubinstein-Stabi syndrome and Sturge-Weber syndrome. So you have to remember this. It is associated with Rubinstein-Stabi syndrome and Sturge-Weber syndrome. In such cases, usually we see a large amount of plaque accumulation, and these people have large amount of tartar formation due to this projection on lingual surface, which is providing a irregular surfaces to accumulate food debris. Now let us see radiographic feature in detail. On radiographically, we can see it is superimposed with incisors, and here the outline is smooth and a layer of normal appearing enamel is distinguishable. So it is nothing but like an invagination from the original incisor tooth on a lingual surface, which is usually looks superimposed on radiograph. Now let us see radiographic feature of this Talon's cusp. As you can appreciate, this structure is nothing but a Talon's cusp, which is projecting on a lingual surface of this incisor tooth. Now let us see how we can diagnose this condition. So we can diagnose this condition very easily. There will be T-shaped elevation on the tooth. So it will be easily diagnosed, and it is also easily visible on radiograph. Now next, moving forward to management. So what we will going to do? Prophylactic restoration of group should be done to avoid early carious lesion. As I have already told you, it is a projection, it is a hindrance, it has an irregular surface. So because of all this condition, the chances of food accumulation is very much. So the risk of caries development and endodontic involvement of tooth is very high. So to prevent that, we have to prophylactically restore such tooth. Or the other treatment we can do, removal of cusp. We can grind the cusp, followed by opening of pulp chamber, followed by endodontic therapy. So this is how we can prevent the tooth. There could be another management as well. We can do periodic grinding, and after grinding, the exposed dentine should be coated with desensitizing agent. So we will grind this Talon's cusp, and because of that there will be exposed surfaces of dentine. So we will desensitize them with desensitizing agent, and we can prevent those teeth like this. So here we have come to an end of this topic. Thank you.